That's a really good question. How do I know about gateways?
Well, I was seeing a therapist at the Children's Hospital, but it's a short-term kind of program, and they sent a referral to Gateways.
One of my teachers was actually like a patient here, an outpatient here. And I think she was just finishing up her time here, and she gave me like a paper with Gateways Hospital, a number, and told me what words to say on the call.
My mom encouraged me very much. She's very supportive. She was always making sure that I got what I needed.
Gateways is a great place for kids and families to get mental health services. And I wouldn't say that just to say it because I work here. I say it because I truly believe that. I've been working here for 20 years, as I stated.
The mental health care system, there's still so much that needs to be worked on, but I think it's good that it's out there and exists, and it's good that there's like a bunch of these like crisis call numbers, you know, and there's a bunch of resources for it, and, you know, baby steps at a time. Like it's tough and it's a real issue.
The service that was provided from Gateways and is excited to be here to talk about the work that she did here with her therapist.
They diagnosed me with anxiety and depression, but no symptom, but not ADHD, you know, because symptoms overlap, you know, and whatever. So that's why psychiatrists exist.
Yeah, the main goal at the beginning was anxiety. I was dealing with it a lot, and we just kind of worked on coping mechanisms and just how to get me better.
And I think the goal is to like try and destigmatize like struggling with like SI, you know.
So Gieneyra was actually one of the clients that I took over from the previous therapist. She decided to stay with me.
So, but I think that's the way to move forward, at least for that person individually. So they're able to be like, they're able to have like support outside of like mental health.
Yeah, I was just kind of finding the skills and how to manage it so that once I'm out there by myself, I can manage with no problem.
One of the coping skills I learned from my previous therapist, where it was like, I've learned to separate the idea or notion that like, okay, like who I am is not my depression or my anxiety thoughts. You know, it's like learning to separate that.
Yeah, I've definitely made a lot of progress, and it's definitely, you can notice the difference. Yeah, since I've been for a few months, but it's definitely worked out well.
Due to the pandemic, we were fortunate enough to be able to do telehealth, and that helped a lot of our families tremendously because they were dealing with lots of stressors. Now that the pandemic, I mean, we're still in the pandemic, but it's lifted a little bit where students are in school. We're getting a lot of the referrals regarding anxiety about returning, about leaving their family. What if someone gets sick? What if I get sick?
Definitely did. Going out, you know, it can be very stressful, not just with the sickness, but there's just so many people in LA. So it was very stressful, and I did spend a lot of time inside at the beginning of the pandemic, and that did create a lot of depression and stuff.
Our caseload right now, we're serving about 280 clients, from as young as 6 and as old as 21.
Yeah, people need to be more intentional about mental health, especially coming out of a pandemic or being in a pandemic right now, and being more intentional about how they treat others and treat themselves, honestly.
I think Gateways, and at least my relationship with my previous therapist, I really have been able to build up like who I am and like the security into myself.
Yeah, exactly. Like we have a support system. Yeah.
I'm really glad I have had Gateways for those 3-4 years build up to the person who I am today.
I am also on medication. I have a psychiatrist at Gateways as well, and they've definitely helped a lot. I've seen a lot of change, and my friends and my family notices it too.
This is small, but we're mighty, and I think we're a hidden gem.
Honestly, I really like it. I love Gateways.
So our future, I believe, is bright. I believe that our school collaboratives are continuing to send us referrals. I think we, since we are now back in the schools, we've gotten so many more. I know that Our probation is running very strong also. I know other school programs, other districts, we're looking at possibly expanding not just within LAUSD, but getting our service out there into the surrounding school districts.
We are here to stay. We are gateways, continue to grow tremendously in the next number of years.